Hi, Dr. Kreider. So, we're going to talk about promoting equitable intervention and special education referrals for English language learners. So, the first part of this we're going to talk about is the common causes for disproportionate representation, which is either overrepresentation or underrepresentation for ELLs in special education. Overrepresentation is often caused because uh, the language acquisition or the language proficiency might set off teachers' awareness that there might be a disability or a learning disability that's impacting their ability to grasp the language. So if they're not meeting the standards um, that are given to them, sometimes they'll get referred for special education assessment, even though that's not appropriate. It's a language acquisition concern and not a disability. Sorry, uh, underrepresentation can happen because of the opposite, actually, where the student might have a learning disability, but because of them being an English language learner or bilingual, um, they are not seen as having a disability, but that it is a language acquisition consideration. And so those two factors can lead to over or under representation, along with many other factors, including insensitive or culturally irrelevant materials, things that students may not be aware of from their culture that we're assessing, and then they're not demonstrating competency in that area, but that could be because of a cultural difference. It could also be in some students or some cultures are more group oriented than individualistic, and so when they're being assessed on an individual basis, they may struggle because they're used to being in a group setting. Um, to prevent this disproportionality, it is imperative that you come at it from a multidisciplinary approach. So um, I work in a high school, and so the English teachers and um, the core area teachers need to be working in tandem with each other. Also with the English language specialist who can determine whether or not what they're seeing is a cause for concern